Hi, my name is Ashley Gallegos, and today I am going to be showing you how to shave your patient's face. So the first thing that you want to do is knock before entering. Then when you have entered the room, you are to identify your patient, and then if your patient has any visitors, just politely ask them to wait outside. And then you are going to identify yourself with your name and your job title. Before and throughout this procedure, you are to explain the steps that you are performing to your patient. Also, throughout this procedure, you are to protect your patient's rights as well as be gentle with them. So after that, you are going to want to wash your hands and then gather your supplies. So the supplies that I am going to need today are paper towels, a washcloth, a hand towel, a towel, gloves, a wash basin, a safety razor, shaving cream, and then aftershave or lotion, and I am using lotion, and then also a mirror. So after you've gathered all your supplies, just provide for privacy, so close the curtains, close the doors, anything like that. And then you are going to identify your patient using 2 identifiers. And then after that, you are going to position the bed, raise the bed for good body mechanics, and then make sure that the bed wheels are locked as well. And then you are either going to position your patient in the semi-Fowler's position, or if they aren't able to position in the semi-Fowler's position, then you are just going to position them supine. So my patient, he is going to be in the semi-Fowler's position. Then I'm going to make sure that the bed wheels are locked, and then I'm raising the bed for good body mechanics. And now I am going to be putting on my gloves, and then so now we are going to be filling the wash basin with warm water, and then we could use a thermometer as well to check the temperature to make sure it's at the make sure that it's warm water as well as according to their care plan. And then we are just going to have our patient also check the water to make sure that it's not too hot for them. And then we are just going to place this on the overbed table. And we also have paper towels laid down, and our supplies are placed over the paper towels. And now I'm going to also take the towel and just place it over my patient's shoulders and chest. And my patient doesn't have bed rails, but if my patient did have bed rails, then I would lower the bed rail that is on my side that I'm working at. So now I'm just going to move the overbed table in a setting that is within my reach. And now I am going to be taking the washcloth, and I am just going to wet it in the warm water. And now I'm going to be placing the washcloth on my patient's face just to get his face moist and all wet. So I'm just going to be applying the washcloth on my patient's face for about a few minutes. And then after my patient's face is wet, we are going to apply the shaving cream to my patient's face. So we're going to get it on their cheeks as well as over their lip and their chin as well. Then after we applied the shaving cream, now we are getting our razor. We're just going to wet it in the wash basin, and now we are going to start on the right side of the cheek, and we are doing long strokes downwards. We are shaving the way that the hair follicles grow, so we are not going to be shaving upward or anything like that. So just shaving long strokes downward on my patient's right side cheek. And then also make sure that you make sure you rinse the razor frequently. So long strokes. And then we are going to be doing short strokes on the upper lip and above the lip, and then also the chin area as well. And make sure you go downward as well, the way that the hair follicles are growing. So now we are doing the chin. Short downward strokes on the chin. And now we are doing long strokes on my patient's left side cheek. And just make sure you are shaving the way that the hair follicles grow. And now just make sure, just look to see if you got everywhere or if you missed any spots. So I missed a spot on my patient's chin. Okay, and now after that, we are going to take the hand towel, and we're just going to wipe off any of the excess shaving cream on my patient's face. So just make sure that all the shaving cream is off. And now, since I didn't nick my patient's face, if you did nick your patient's face, just make sure you apply direct pressure over it. And if you did make any nicks, just make sure that you do not apply the aftershave or lotion on it. So I didn't nick my patient, so I'm going to be applying lotion on my patient's face, and I'm just going to warm it up because it's a little bit cold. And now I'm just applying it on my patient's face. And now I am going to be showing my patient the work that I have done and make sure that my patient likes it. So he said I did a good job. And now I am going to remove the blankets from my patient, and I'm just going to put this in the laundry bag. And now I am going to remove and discard my gloves, and then I'm just going to wash my hands, and then I'm just going to provide for comfort to my patient. So I'm going to, since I raised the bed for good body mechanics, I am just going to lower the bed so it's at a safe level for my patient. And then I'm going to also make sure that the bed wheels are locked. And then I'm just going to, since my patient doesn't want to be in the semi-Fowler's position, I'm going to put him back in the position that he was in before. And my patient doesn't have bed rails, but if he did, I would put the bed rail back up. And then I am also going to put the call light and any other items back within my patient's reach. And now I could put on, I could wash my hands and then put on gloves. And now I'm just going to be cleaning the overbed table. So I am just going to put the washcloth and the hand towel that I used in the laundry bag with the towel. And then I am going to put the razor in the sharps container and when you put it in, since we took the cap off, we're not applying the cap back on because we may cut ourselves, like cut through the gloves. So we are just going to put this in the sharps container, and then we are going to put the lotion as well as the shaving cream back where they are supposed to go, as well as the mirror. And then we are just going to clean, rinse, and dry thoroughly the wash basin, and then put this where it is supposed to go. And then we are going to take a paper towel and then just wipe the overbed table. And after that, we can remove our gloves, wash our hands, and then we could move the overbed table in a safe, appropriate setting so no one will trip over it or anything like that. And then we are just going to unscreen our patient and do a safety check around the room as well. And then we are going to report and record any observations to the nurse. So if I did nick my patient's face, then I would report that to the nurse, anything like that. And that is how you shave your patient's face. Thank you.